What's happening, young respiratory therapists? We're going to go over some materials today. I'm hoping this will help you to figure out what's what and help you through this RCP 120 course. I know you've been struggling. We're just going to start from the beginning. But before we start into the book, we're going to talk about the book. But before we do that, we're going to try to go over some terminology. So on your test coming up, you'll have to know the term hypoxia is a decrease in oxygen supply to the tissues, while hypoxemia decreases oxygen to the bloodstream. So if oxygen is decreased in the bloodstream, it's because oxygen can't get through the lungs and into the blood. If it can't get into the blood, then it's not going to get to the tissues. Now, you know that eventually we're going to talk about the types of hypoxia and all the reasons that oxygen may not reach the tissues. So I appreciate you. I think you're doing very well. So just hang in there and don't lose faith. We talked about hypercapnia, and hypercapnia is an increase in CO2. What I would say is that if I'm looking to evaluate ventilation and how the patient's ventilating, then PaCO2 is how I'm going to do that. And then if it's high, I'm going to call that hypercapnia. We know that hypercapnia is caused by hypoventilation, and hypocapnia is caused by hyperventilation. And that's all measured by the patient's PaCO2. So relate PaCO2 to ventilation, and then we're going to relate PaO2 and saturation SpO2 to oxygenation. Remember that the FiO2 is the fraction of inspired oxygen, and that's really going to be talking about what percentage of oxygen the patient is breathing. If they're breathing room air, then that's 21% oxygen. Yes, it is. All right, indications for oxygen therapy. This is where we start talking about what's in the book. This is on page 6 at the bottom right of pursing. We can also refer to the Egan book, the chapter over medical gas therapy. But pursing is what we've been following, and hypoxemia is an indication, as is labored breathing or dyspnea. Remember that labored breathing or dyspnea, there's a couple things, indicates an increase in the work of breathing, but dyspnea is also, it's a symptom, it's something that the patient tells us. They explain to us that they're short of breath. Number 3 says an increase in myocardial work, and this is typically shown to us as tachycardia as the first indication of hypoxemia. Tachycardia seems to be, or really the heart rate is a great monitor of the patient's condition. So if the heart rate's going up, then something's going on with the patient. The first thing we want to think of is what's their blood gases, how's the PO2, are they oxygenating? And if not, then we're going to support their oxygenation. Just having a patient having tachycardia indicates the need for oxygen. So, all right. So in the book on page 7 at the top left, it talks about the signs and or symptoms, and we talked about the difference in those two things, of hypoxemia. Tachycardia is the first clinical sign, the body's first response to hypoxemia. Tachypnea, obviously increase in respiratory rate. The person might tend to breathe faster, of course. That suggests that you would need to know the respiratory rates, somewhere between 10 to 20 breaths per minute, somewhere like that. Dyspnea, remember that's a subjective finding, a symptom, that's something that the patient tells us. If the patient is cyanotic, then that's a late sign, and that's a sign of severe hypoxia. And remember that we just talked about central versus peripheral cyanosis. So central cyanosis is a very, very bad sign. It must be dealt with quickly. Very good. And then the patient's blood pressures are going to go up. That's hypertension. What I would tell you, if the patient becomes restless, disoriented, confused, this is something we have to deal with right away. All this is decreased oxygen to the brain. So anytime you see this, you got to take really important drastic action. So you have to, this is a patient who needs to be treated and taken care of right away. So disorientation or confusion or anything like that is possibly a sign of decreased oxygen to the brain, and we need to go ahead and just give the patient a high level of oxygen to make sure we support their oxygen to the tissues, especially to the brain. So requires immediate action. All right, assess the need for oxygen. This is the blood gas, right? So the blood gas, we said that, oops, sorry, I'll do that. All right. The blood gas, we said we would need to be able to support the blood gas or support the patient if their blood gases are deteriorating. The first thing you got to know is what is the normal blood gas value, what are the normal blood gas values, and so you got to start there and then be able to evaluate from there. Evaluating hypoxemia, normal PaO2 on room air is 80 to 100 millimeters mercury. We're going to call anything less than 80 mild hypoxemia. We're going to call anything less than 60 PaO2. This is PaO2 that we're referring to here, by the way. If mild hypoxemia is a PaO2 less than 80. Moderate hypoxemia is a PaO2 less than 60. And severe hypoxemia is a PaO2 less than 40. All right, thanks very much, and please take an opportunity to look over the PowerPoint that we've put together, and please ask me if you have any questions, and I'll be glad to help. Thanks.